Hi, this is Dr. Punit Thawani and I'm excited to participate today in the Inform and Inspire series powered by Yardstick Marketing. Today I'm going to give you a few tips on how to take care of your oral health. And no, it's not just about brushing and flossing, so stay tuned. First of all, why is it a big deal? Why do we need to take care of our oral health? Well, we all know that there are millions and millions of bacteria that live in our mouth and call it their home. These bacteria tend to form a layer over the teeth and gums called dental plaque. And if this plaque is not removed periodically, the bacteria tend to increase in number and start causing problems. There's a lot of research that has happened in recent years that has shown that these bacteria and the inflammation caused by this bacteria in the gums does not remain localized to the mouth only. It tends to spread into other parts of the body. So much so that in one research paper, the researchers actually found bacteria from the mouth present in blood clots in the brains of victims of stroke. People who themselves suffer or have a family history of diabetes, heart disease, preeclampsia, certain types of cancers, and stroke are at a much higher risk of developing these problems if they have poor oral health. In a time of the COVID pandemic, when all of us are looking at ways to boost our immunity, taking care of your general health and taking care of your oral health is of vital importance. So how do we do it? Well, here are a few tips. Let's start with the obvious. Number one, of course, brushing your teeth twice a day. We all know this. Use a toothpaste which has some fluoride in it, and please use age-appropriate toothpaste for kids. Secondly, interdental cleaning. Some form of interdental cleaning needs to be part of your oral hygiene routine. This means cleaning between the contacts of the teeth. It could be with flossing, it could be with water flossers or interdental brushes, but some form of interdental cleaning is a very important part of the oral hygiene routine. Speak to your dentist to know which is the most appropriate for you. The next one is diet. Now, a lot of us tend to eat foods which are high in sugar. We need to cut down on these. Cutting down on sugars and any form of processed carbohydrates is really helpful in improving your oral health. Also, increase your intake of water and fiber, as these are natural cleansers of your teeth and are good for the overall health as well. Now, the fourth one is regular visits to the dentist. Now, this is one that all of us miss. If a dentist sees you regularly, ideally twice a year, they are able to make sure that your oral health is at the optimum level, and they're also able to make sure that they catch any problems in the initial stages, thereby reducing your future dental expenses. So please make sure to visit your dentist twice a year as well. And lastly, try to add some xylitol to your diet. Now, xylitol is a naturally occurring sweet substance which tastes sweet, but it actually starves the bacteria. It does not form food for the bacteria. It actually starves the bacteria in your mouth and thereby reducing their number. You can add xylitol in forms of chewing gum, mouthwashes, toothpaste. There are many such things available. So try and do that as well. Well, I hope you found this helpful and interesting. And once again, this is Dr. Punit Thawani reminding you to brush, floss, rinse, repeat.